The nurse in the medical unit is caring for a client being treated for hypertensive crisis. The nurse suspects that the client is developing an abdominal aortic aneurysm. Which of the following are expecting findings of this complication? Select all that apply. 1. Abdominal brute. 2. Upper back pain. 3. Hoarseness. 4. Pulsations around umbilicus. 5. Shortness of breath. A client is scheduled for CUB, kidney, ureter, bladder, radiography in an outpatient setting. Which of the following actions should the nurse take to adequately prepare the client for the test? Select all that apply. Your options are: A. Instruct the client that they must be NPO for 6 hours before the examination. B. Administer an enema the evening before the examination. C. Administer furosemide 20 mg for half an hour before the examination. D. Inform the client that no special preparation is needed for this examination. E. Ask the client to drink fluids and empty the bladder just prior to the examination. During a home health visit, a nurse arrives to find a male client lethargic and confused. His wife mentions that he fell down the stairs approximately 2 hours ago but had seemed fine immediately afterward. What actions should the nurse take? Select all that apply. A. Place a call to the client's health care provider for instructions. B. Send him to the emergency room for evaluation. C. Reassure the client's wife that the symptoms are likely to be transient and will resolve soon. D. Instruct the client's wife to monitor his condition and to call the doctor if symptoms worsen. E. Assess for other signs of head trauma like pupil dilation or irregular breathing. A nurse is assessing patient with second-degree burn in right arm extending to its chest. Which of the following signs and symptoms prompts the highest priority of intervention? A. Hoarseness. B. Edema and swelling. C. Tingling sensation in the extremities. D. Cold and clammy. The nurse provides care for a client post-PKA. Which nursing interventions will help the client to prevent a contracture post-operatively? SATA. 1. Keep the residual limb elevated at all times. 2. Ensure the residual limb is positioned flat on the bed. 3. Position the client prone several times a day. 4. Keep head of bed elevated with knees up. 5. Apply anti-embolism stockings to the unaffected leg.